I think you're live.
I'm live. Hi, my name is Jay McCallum, and I'm with Core Balance Therapy. Wanted to keep on posting a video a week or so, and today we wanted to talk a little bit about what to do if you have your back kind of go out. You know, this acute back pain that comes on without a really big injury. Wake up in the morning with your back very painful and stiff, or bend down to pick up something small and have this jolt of acute back pain. So first thing I want to say is this is hugely normal. This happens to people all the time. 80-90% of people in their lifetime will experience at least one episode of pretty disabling back pain, and it is almost always not a bad thing, a dangerous thing in terms of having torn something, herniated disc, something bad like that. So times when you should worry about it or perhaps get it checked out more urgently. If you have bad back pain after a significant trauma, you're in a car accident and you get back pain, you should probably get that looked at. Back pain that's accompanied by bad radiating leg pain, numbness or weakness in a leg should get looked at. Certainly if your back pain comes on and is associated with difficulty controlling your bowel or your bladder, that needs to be attended to right away. But all of those things are really, really rare. And so the first thing probably to do is to just take a deep breath and say, this is okay, this is normal, and this usually passes in a matter of days to a couple of weeks. So the other piece of advice is try to keep moving, try to keep living your life, you know, avoid things that are particularly painful as much as you can. So it's probably not the time to do the heavy landscaping project that maybe you had in mind, but back pain usually does better with movement and activity than it does with a lot of rest, and bed rest in particular has been shown to actually extend the recovery period and make it take longer for you to get better. So, so keep moving. You know, use heat if it helps you. Take a little short rest during the day. Just get gravity off your back for 10 minutes and then get up and move around again. That can help. Resting for longer than that often makes it stiffen up and gets it worse. A couple of exercises that I like that are really intended to just loosen your back and get blood flow through your back and help it relax and move more easily. I just want to show you a couple of things that I often prescribe to patients. The goal generally with these is to move in the range that you can, that either doesn't hurt or just feels like you're just kind of touching it and just kind of touching the soreness and loosening. We don't want to stretch it real hard or do anything real forceful when it's really painful and sensitive. So let me show you the first one. I usually teach it laying on the side, so I'm going to just kind of side with the table here, and knees pulled up or the top knee across like this, and just working on doing a little bit of rotation, rocking back and forth. I'm really generating most of the force with my arm and letting my back stay quite relaxed. And you know, it might just be a little small movement at first, just relaxing, letting my trunk go and moving, and gradually make it bigger as you can. So doing that, working on that on both sides. The other movement that often helps is a hands and knees position. So I'm going to come around here. Hands and knees is a lovely position because I can get gravity off my back and I can still have some freedom to move. And you know, the classic is sort of the cat-cow movement like this, but really what we want to do is take advantage of the fact that gravity's off and your back's free to move, to just play around and just find ways to move that feel good. So a little bit of side to side, we sometimes call this wag the dog, or moving in circles, or sink and lift and rock back and forth, and do a bit of movement like this, just in ranges that feel good. The key probably is to do little bits of these movements fairly often, every hour or two, for a few minutes. Think of it as bringing just blood flow through the tissue and helping it be calmer and less sensitive and heal more quickly. So certainly if you're struggling and it's not improving, acute back pain is something that we often can help. So if it's not responding to these simple measures, give us a call and we'd be delighted to see you and give you a helping hand. Thanks for listening, and we'll talk again to you next week.